are live inside Studio 10. Well, proper dental care is an important part of your overall health. But many people wait until there's a problem before they actually go to the dentist.
Delay it just as long as possible, right? But you shouldn't do that. Fear of the dentist is common, but delaying the necessary treatment is the thing to fear. Here now is Dr. Michael Dickerson from Aspen Dental. And doctor, if your teeth are healthy, the rest of your body tends to be in better shape too. Why is that?
It's very true. The mouth is connected to the rest of the body, and studies show us that there's a lot of links between oral health and overall systemic diseases, including diabetes or including cardiovascular problems. So it's important, if you're looking from an overall health perspective, the mouth and oral health needs to be included to have an overall healthy person.
I read that about flossing is connected to cardiovascular health. How is that a link?
It's interesting, and flossing and periodontal health is now even being attributed to Alzheimer's disease in new studies. So it's really amazing how we see new health links all the time, starting from potential oral conditions.
Now, to be perfectly honest, as we were saying earlier, no one really that much looks forward to going to the dentist, but if you've got the slightest inkling that there's something wrong, it's just like getting your roof fixed or getting your car repaired or whatever. The longer you put it off, the worse it's going to be, and probably the longer it's going to take to get straightened out.
You're exactly right, and let's be honest, there's not a huge portion of the population that really enjoys going to the dentist.
You don't get pumped about going to the dentist.
Not unless you really like your dentist.
That's right.
And that's what we're trying to do at Aspen Dental. We're trying to increase access to care. We're trying to break down barriers, whether those barriers be financial barriers, whether the barrier just includes that I'm terrified I had a bad experience as a child. 47 million Americans have some sort of gum disease or cavity problem or some sort of an unhealthy mouth. And I think that's too many. And I think what we're trying to do at Aspen Dental is increase access to care from extended hours, from weekend hours, from being on call 24 hours a day, to putting on a smiling face when patients come in the door, so we can help them feel comfortable and actually want to come to the dentist. And that's the most rewarding part, I think, of any dentist's job, is seeing the patient that was so scared and changing their life. And that's really what we try to do.
Because if they want to come, they're going to be coming regularly, and you're not going to run into those things that are going to create huge problems down the road.
You're exactly right. If we can fix the problem before it becomes painful, before it becomes symptomatic, it's much easier for the patient from every aspect, from a cost aspect, from a comfort aspect, and just really from a quality of life aspect. Dentistry is different because it doesn't necessarily hurt until the problem is very big. And it also doesn't get fixed by just resting or hoping it goes away. So if we can help patients get access to care, we can really increase their overall quality of life.
We hear a lot of different things about how much water we're supposed to drink, how much exercise we're supposed to get. What is the common thinking now in regard to how frequently you're supposed to brush? And has that changed much over the years, or has that stayed pretty consistent?
Ideally, in an ideal world, I think we would brush and floss and use a mouth rinse after every meal. But a couple of things to remember. The bare minimum, if we're doing 2 times a day or if we're flossing once or twice a day, that's a good thing, but the more care that you can provide at home, the better. And especially one thing to remember is to watch the diet as far as highly acidic foods, highly sugary foods. There's a lot of stuff that tastes really good that is not the best for our oral health. So combining good home care, frequent trips to your dental provider, and then watching dietary influences can help a healthy mouth.
I'll never forget this science project I did middle school. I put teeth in different,
Sure.
water, Coca-Cola. Let me tell you what, the tooth was gone.
Sure. Oh, seriously?
Gone.
Oh my God.
Gone. But a question about water. How much is there less fluoride in the water now? More fluoride? I mean, it's important the kind of toothpaste we use, obviously.
And it's interesting. That's a great point. Cavity incidence is actually increasing in our society despite better products available. And a lot of bottled water that people drink doesn't have fluoride, so that's something to remember too. With dietary influences or with bottled water without the fluoride, people's incidence of cavities is going up, and we see that especially in an elderly patient population. population, and that's one portion of the population we really want to make sure gets proper nutrition, gets proper home care, and gets checked out by their provider to make sure that their quality of life is good.
You were talking about brushing and flossing and using mouthwash and everything, but I have heard, tell me if this is true or not, is it actually better, like if you could only do one thing, is it actually better to floss than it is to brush?
I think that you might get different responses.
And I know I'm putting you on the spot here, but I just found that interesting.
I'd say, if I had to answer, I'd say let's focus on brushing, but if you took the extra minute or two to do everything, it'd make your results even better.
Interesting. I heard that as well, that if you had to pick one, you should floss, but I think most people would agree that you want to go ahead.
I would say so.
Well, it's great to sit down and get to know you, and if you'd like to know more, by all means, check out Aspen Dental at aspendental.com. You have 6 offices all over the Bay Area here.
6 offices, lots of hours, and try to make it as convenient as possible for patients to get the care they need.
800 Aspen Dental. Doctor, thank you very much for being with us
today. Thank you very much.
Thank you. Great job.
Thank you.
Don't go away, everybody. We're going to check in.